our social view. So what we want to do for Linda is we want to divide her face. We want to relax these lines. We want to lift this area, soften the nasolabial fold, bring this fat pad up to where it used to be. We want to, if we can do her lips, we can add a little bit more structure. And then we want to relax her face and fill in a little bit here. So you see where she's a little depleted, we could bring that out a little bit. Okay? Well, let's start with Botox. So the first area we want is we notice these lines right here, right above the nose. So I'm going to have you scowl for me, okay? Scowl. So we have medial corrugator, lateral. Her lateral corrugators come to here. Now relax. Now, if I mark them, they're a little bit too close to mid-pupil for my taste. So I always want to make sure I get the procerus. It's a nice big muscle. Medial corrugator. I'm going to come in a little bit and do lateral corrugator. I'm going to do the same thing on the other side. See how far I am away from the pupil? I know I'm safe. Okay? Now I'm going to have her smile. So when we think about doing the crow's feet, 80% of the time we can get away with really one way of doing it. We go straight out of lateral canthus, 45 above, 45 below, stay a centimeter and a half away, and inject away, 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 and we're going to relax all these muscles. So we're going to do the same thing on the other side. 45 above, 45 below. Pretty much we get all the lines. Okay. So when we look at her too, we want to make sure that the brow is on or above the orbital rim, and she is, and she's here also. So we're going to ask her to raise your forehead. Okay. Relax. We want to get all these lines. Okay, relax now. Now, how lateral do I want to go? A trick that works really well for me is I'm going to have you scowl again. I'm going to follow up the lateral end of a corrugator because that's where she's going to pull. Relax now. That's where she's going to pull or spock up if we don't inject here. So that's going to be my most lateral on this side. I'm going to do frown again on this side. I'm going to do the same thing here. Stay halfway up. And that's going to be my most lateral on that side. Okay? And then I'm going to go mid, a little bit above, so I get all these muscles. And I'm going to do these 5 injection sites. And that's going to soften all of her lines above. Okay? Of course, everyone's a little different. I'm just giving you a general what works for most people. So how many units? Here, I'm going to say in her glabella, it should be at least 20 units. That's a powerful dynamic muscle. She's not that powerful up here. So here I'm going to inject 4 units, 4, 8, 12, 16, 20. Here I'm going to inject 2, 4, 6, 8, 10. Here I'm going to do, I can do it one of 2 ways. 4, 4, 4. Or I like to do 5, 5, 4, 3. Because what that does, it gives me the least amount of pull from down here, and she won't get extra lines because that tissue is so soft. So I like to think of titrating down for the crow's feet.
Okay? And Karen, as you've always said to me, you can say on her, this takes a little longer, your first interaction with the patient.
Right.
But eventually she'll have the outcome she wants. You'll know her face, you'll have the chart, and boom, boom, boom.
And mark down exactly, Allergan gives you a little face. Put down, how many units in each area? It takes literally 30 seconds, not even, it takes 5 seconds. So she comes in and you go, were you happy the last time you were here? Yes, we're doing the same thing. Okay?
Can you go over them this one?
Okay, so what I do is you can't really see it, I want her to frown for me. You see the tail end of the corrugator, how she's pulling?
Yes.
Okay, if we don't inject the forehead, what happens is these muscles still want to work, so we're going to knock them out here, but it's going to work lateral, and that's when you see people who have the spock. That's
Can you frown
caused
again, Len? Oh, I see. It's right
Oh, you're
there.
such a good friend.
I know.
She had so much
And
of
she's
Yeah,
someone
so-
I had the bunny nose.
Okay, and she's someone also that I would inject
Go
the
deep,
nasalis,
yeah.
and I go bunny up. Okay, relax. Mark it. Mark it. And when I inject, I push up because that's a sensitive area, and I inject like 3 units on each side of the nasalis.
And
but
where
that'll
you always
do.
go to the lowest part of that bunny frowns, or what?
With her, well, no, I just go to the lower, but what I want to is I want to be able to push up, because I'm going to inject actually higher, because I'm going to push up to give it a little bit more tissue and inject straight
And what do
in.
you do about the lines that go across the nose?
Here, that by injecting here and doing the nasalis
Yeah.
is gonna soften that. Eventually, it's like ironing, it's not gonna do it the first time, but each time she comes in, it's gonna get better and better.
So this here is to avoid this pox sign, is that you said? I used to do like a little bit higher, so how did you come up with just
Okay,
like two
because
finger breadth?
I went halfway above. I went halfway above, and that's gonna be where I start. If I go here, I mean, she still has all these lines here, I wanna address it, so I'm gonna sort of scatter it.
Yeah, so it's
Make
like
like
at least like a
mhm.
sonometer
Yeah.
above. Okay, all right.
And you said 4 units in each of the.
Yeah, because we're gonna do 20 units here. And what I'm gonna do is I'm gonna grab, inject, grab, inject, not lateral to this, like medial to it right here.
And this one you're gonna be pointing.
And I always inject away, away, away. Sometimes I'll spread the skin so I can see a vessel. Sometimes you hit it.
And
just
you're
come
always
out.
also injecting away in the mid-forehead?
Always.
Or-
I'm injecting up mid-forehead.
Diana?
And how about the corrugator? Do you
The
inject
corrugate is, I dart in.
Diana?
and then
in.
process in? Okay, thank you.
Okay.
Okay.
You're gorgeous, look at
Okay.
you.
Okay, so now we have,
The syringes and the needles?
do you want to use your dilution, or do you want
No.
to try the thinner, the different dilution?
We have to use your,
I don't mind, I'll
Yeah.
use my needles.
Where do you
if
get
wanna
those
try.
syringes?
Oh,
so I'm gonna do like
Oh,
half
there is
then.
some
This is
syringes?
I'm just getting
Oh,
your
okay.
marks on
I
your
tried to go
face.
downstairs to get it, but they were closed.
Where's the syringe?
Okay.
I tried to go to the pharmacy, but they were
so
closed
what I want
already.
you to do is pull up,
My lines,
what I do is I decap.
because I'll show you.
So
You're gonna be very famous, you're gonna appear on my video. All right, Kristen?
Yeah.
Yeah.
Yeah, well, this one's not going on Facebook, right?
Well, thanks for the text.
But so here, Kristen,
Did you practice?
this was 1
Haven't
week.
had time yet.
That was 1 week
The
when Dr.
syringes,
Safe did
oh,
it, and that
okay,
was
I'm
2
sorry.
weeks.
Wow.
With the nurse when she tried last time.
These?
This is already has been on it.
I personally think toxin is the hardest one because there's so many different moving parts and whatnot. The bone is a slam dunk. You really can't go wrong along the bone here. Lips are a challenge. Folds, anybody can get a fold.
You do
I
the
could do
bacteria.
it.
I'm sure you
Very
lose up
confident
very
I can.
fast.
Are we going to use Volumetine
You
just
have
to
a lot of
see?
patients
Yeah.
and-
You'll see.
He's doing, he's doing the whole, he
you?
says that's it, I'm
I
the
told
old
her she's
lady.
probably gonna have a $5,000 to $7,000
I'm the
rejuvenation.
old lady that's gonna look
phenomenal.
younger. Because you guys are all so much
Should
Well, we
younger.
want you to see the wow of what everything can do, and it's not gonna. It's rare you're gonna get a $7,000 patient. It happens. Don't get me wrong. They say hit me with everything now, but it's a stepped out process
Oh, all the
and a
patients are
plan.
gonna see this,
Okay,
forget
I
it.
want to see you now for toxin. 2 months, I want to see you now for Juvederm. After that, I want to see you 3 months for Voluma, and it's a continual process.
But once I show the patients all the pictures.
Okay. Lori says she's gonna be my guinea pig.
Okay.
No, Diana just asked me if I would like you to do it.
Well, let me tell you this, why I
She
think
said
that's a
that?
great idea is because you travel around all the practices and
Yes,
you interact with a
you
lot of
should,
people,
yeah,
and you
definitely.
can say, look, this is
what
what's
I
been
do.
done to me.
And he
I don't
did.
look augmented,
Yeah.
I look refreshed.
Yeah.
Yeah.
That's the best marketing you could have in any office. Posters, yeah, I give you all that, but
No.
live bodies, who can say,
And
didn't
you-
hurt
yeah.
at all.
And they
You
see
know,
it,
I
yeah.
look natural, and Dr. Safe is great, she's been treating people for a long
That's
time.
exactly how she got the Botox here and the chemical peels because she did them on me and I had before and after pictures.
Yeah.
And people saw when I had my face all red and then they saw me come back.
Did you take a picture of yourself before and after?
Yes, we took a bunch of.
Well, you saw my after picture for Kyle,
Yes,
right?
exactly, yeah.
I wouldn't remember what I looked like.
Right, exactly. That's what I said, yeah, because I had,
Pause, I stopped and started.
but I also have, because that's what I was saying, this one we did the first
Oh,
time.
man.
This is 1 week
Yeah, it's-
and that's 2 weeks. That's good.
Awesome.
So this
Did
is what I
you
showed the
pause?
the
Did I
patients
go
when
get
we did
another
it.
one?
And then I had the, when we did the chemical
Yeah,
peels.
so it doesn't have a pause.
And,
And again, Botox isn't an exact science.
Do you want to?
So when you're doing,
I could do with it.
so let's say you're injecting here, if you do
These are insulin syringes that you put 30 units into. The Botox is diluted with
Ready? That's her
0.9%.
cheek original.
normal
Let's blow your
saline.
mind, you ready?
Yeah.
Keep going.
Each tiny little line
represents
represents 1 unit of
Yeah, that's what I
Botox.
showed the patients, that's why we did so many TCAs
Will
to
the
labor.
Botox patients turn into filler?
And then the
or-
Botox, when she
Our
did
field
it,
patients
that's
turn
why
into
she did it with
Botox.
your. They do, exactly, because I
You
show
did?
them the pictures when she did the Botox on it. But this is a week after when she did it, and then that was 2 weeks after.
Wow.
So
Yeah, so you see how good
You
it
can see
works
it,
as
yeah.
compared to that stuff they
Yeah.
use there? That's the only
Yeah.
stuff that's not.
that's what it was. So then all the patients saw it.
Can you
That's why
send
they
that
started
to
seeing it.
my,
Yeah, but that's
phone?
why everybody saw Dr. Safe get the Botox when we did it. I show everybody. Everybody sees me brand and peeling and everything.
They want you to let the Xeomin sit for 5 minutes before you inject it. Can you tell me what, it just blows my
Oh,
mind.
it has to sit for 5 minutes?
Yes.
Oh, okay.
Yeah.
Okay, so where am I going?
And after dilution, it should sit for 5 minutes.
Yeah, here's the
And
pillow.
before it is injected.
Because I'm gonna do volume on her, so.
Pull out her leg rest.
Botox, you guys want to do the Botox?
Pull out her leg rest.
Let's try it. Okay, you guys can do the Botox, Liz, if you want to. Yeah, you can do Botox. Okay, because Dr. Safe's going to do Voluma, so you guys can do Botox. There's just so many spots on my face, you all can do some.
So what I want you to do, we're only going to do 10
November
minutes on each side, because we
22nd,
only have
everybody's
15
having a good
minutes from the
time.
Bible. So what I want you to do.
The whole gang is here. Hi. Hello, hello,
5
hello,
units here, so I want you to inject each one of these, boom, 4 units.
4 units, okay. And each line is a unit, correct?
Correct.
So we go right here.
Press
Hold
it,
the
grab,
muscle.
perfect, straight in, just go straight in below it.
And I don't need to retract.
The wrist
You
is
don't
going
want to go into
straight
what you did, go
into
deep.
the corrugator and procerus muscles,
Let me see.
putting in 4 units in each
No,
dotted
you want to
line.
inject deep, no,
Or
you don't
each
come
dot.
out, you want to go in. No, no, let me show you what I mean.
Now we're going to see the expert do it.
So in other words, when you go in here, it's okay. You're going to grab, go straight all the way. See? And then you want to do, maybe I'll show it. Okay, now you want to inject.
And how deep are you going when you do that?
Deep
All the
into the
way.
muscle, I'm burying
Bury
the
the
muscle.
muscle.
Muscular.
There's this spot? Yep,
Yeah, hold the muscle.
straight in. 4 units, so a little bit more, a little bit more. Okay,
You go, girl.
grab here. No, I want you to go.
Bury the needle.
Bury the needle. You want to go deep and put in 4 units. 4 units, a little bit more. Perfect. Okay. So now we just do this whole.
You can get, yeah, don't worry about me, go for it. Seriously, do what you gotta do. Learn. I'll
So
take
we
it out
just
on you
did-
later.
You saw that, Neil, you just did that?
Yes.
Okay. So now what I want you to do, you have 2 units left here. So when you inject here, I don't want you to go into the white. I want you to go right next to it. And you see how I bury the needle here? I just go straight in, 2 units. And I'm going to do this one here. So I'm going to do the same thing, 45 degrees, bury the needle, and inject.
And why don't you go straight where you marked?
Oh, because I don't want to,
Get the weight
if I
in
go,
it.
I don't want to
Get
do the
the
whites, I don't
makeup
want to tattoo her.
Got it.
Yeah.
And it's also,
So
even though.
when you inject it, you're actually injecting at a 45-degree angle.
Correct.
How do you know you're in the muscle? It's so thin.
Because I'm burying the whole needle, 45 in, I'm burying the needle, I'm in the muscle.
How many units are we doing?
2.
So we're not grabbing the muscle,
No,
right?
so here you want to taut it a little bit, go right underneath it, and bury the needle, and put in 2 units. Perfect. Okay, and that's why I always erase. Perfect. Go straight up, bury that needle, 2 units, and
Here.
go. So you never want to go here. So you never want to go below the line. So you're going to go like right here, and bury the needle and put in 2. Perfect.
Don't be afraid to bury it. Go ahead,
Okay,
stick
and
me.
we're gonna soften, what's that gonna do? That's gonna
Don't.
soften. So now you have here left, so we have 4 units, so for the nasals, I'm gonna say bunny up, relax, because I want enough fat, because it hurts. Bury my needle, put in 2, and I want you to do the other side. And then I massage.
Bunny up? Right here.
Perfect. Bury it. And you just did the nasals.
So cool.
How many did you put in each spot?
You wanna do some?
2
Two,
units?
2.
She probably could use more.
You could do some.
She probably could use more, but, okay, so now we have, I have this one.
The crow's feet.
So I want you to go, so there's 18 units here, so I want you to do 9, so do 3, 3, 3.
Okay. And Kristen will do that side.
So what I- yes, what I always-
This way you're on the side.
Exactly. So what I do is put my finger on the orbital rim, so I'm always know I'm safe, and inject away. But you make sure so you're comfortable.
And it's superficial, right? It's like a black, right?
Here.
Yeah, straight back, carry the needle. Inject.
How many?
3. Perfect. Now come straight across. So
I wanna
the
see
thing
this
to do,
video.
Don't pull it this way, because you always want to, you don't want to inject
Okay.
closer. So if I taut the skin like this, and hold the needle, taut the skin like this, and I'm going to go straight in, give her 3 units. Perfect. And then inject back.
I'm gonna have my
Not
thumb
down,
there,
because
though.
you don't want to go down, because you don't want to hit any of the muscles that, so you want to go low, you want to go low where it is, but not below it. So always back. If you think about it, bury the needle. It's a long muscle, so you want to inject away 3 units. A little bit more. Perfect. Okay?
Kristen, did you?
Stay on that side. Come on this side.
Okay.
And this is, again, do what you're comfortable, but I like to inject. I bring her face this way, hold up like this, and always inject away. Perfect. Bury the needle. All the way. You want to go 3
I like
units.
how you're doing this, you're moving the patient's face to make you more comfortable.
A little
If
bit
you
more.
try to move yourself around, you're gonna end up hurting along in the end of your years.
Perfect. And now you're going to put 3 this way.
Make the patient move.
Sorry, I'm resting on you.
Me, don't worry about it.
She's not even flinching.
We only breed tough women here.
And inject away. You want to just
Would you go a little lower?
You can go like here,
Okay.
and you just don't want to. You don't want to point the needle down. You just want to get it in. Perfect. And bring it home.
Okay.
Perfect. So now we've just did 3 areas of Botox, 50 units, and we did it like
50
really
units, see.
under 5
How many minutes did you get?
50.
Told you I was old.
She
But
got the
that's
whole.
not, 50 units for 3 areas is not a lot. A lot of people undertreat, and 2 things happen. This is a strong muscle, so if we undertreat it, because the patient says, I don't have enough money, so that I only want to use 15 units. What happens is, this muscle still wants to work, so it's relaxed slightly, but it's wanting to work so hard, it actually looks stronger than it did before. So they may actually look worse by using too small amounts of Botox. So here you always want to hit heavy. I would say the very minimal is 15, rarely ever do that. 20 to 24 for a woman, 25 to 30 for a male. Okay?
You tell the patients to frown or try to relax their...
I have them
Afterwards.
frown so I can see where the tail ends of the corrudate for the markings.
No,
and I have-
afterwards, after the procedure.
You know what? I don't really believe in that because I think we're injecting in the muscle.
Doesn't matter what they do, really.
No, I tell them don't lie down for an hour or 2 flat. Don't exercise till the next day. Don't get a massage where your face is in a donut. And pretty much go about your activities.
And a lot of that is anecdotal, there's been no clinical trials on that or after effects as to what should be done. A lot of that is just what people have learned and picked up over the years. And we always say, look, it's
Yeah.
Go home and relax. Take a day off from the gym, you will survive. I promise. And from a financial perspective, this took all of about 5 to 8 minutes. That's probably about $300 profit for the practice.
Yeah, XC doesn't
And
So,
once you get good at it, you can do that in 5 minutes, knock it out.
so,
That's more along the line of dermatological.
Okay. Okay.
so the next thing that I want to do is we want to treat the mid-face voluma. Okay. So we want to bring this fat pad up. What used to be, we're going to pull her more like this. So she's going to get more of a cheek. So if we look at her from above, okay, come back, yeah. Come back here, relax your face. You can see she's a little bit full here, she's flatter here, she's very flat here. What we want to create is this, that OG curve, okay? We want to create this on the other side as well, okay? And that's going to pull everything back, okay?
So you're
that's our
going to
goal.
you want to fill this area here?
Lateral lift, so I'm going to always
Between here and
start,
there, between the zygoma and...
the whole, most of the product's going to be in the zygomatic arch.
Okay.
We are going to hit antemedial, but not before we hit the zygomatic arch, because the more lateral you are, the more lift you get. So you think of Voluma as lateral lift Voluma, okay? So how do we know how to divide the face? Now we clean the face in a deep product, so I like to keep this sterile. Again, this is just me. So I'm going to divide the face, and I want to make my injecting as easy as possible. So I'm going to take this, and I'm going to do my first marking. You'll do the other side from the outer canthus to the oral commissure. Now, I want to isolate the zygomatic arch. So I go from mid-alar to mid to upper tragus, and I feel where that bone is. Because I'm always going to inject above the bone for the zygomatic. And I'm going to go across. So what I'm doing here is I'm creating the zygomatic arch, antemedial, submalar, no fly zone. I never want to inject in here. It's just going to make her fuller. My whole goal is to pull that up.
Yeah.
Okay. So most of the product is going to be injected into this arch. Depot injections, you go straight down to supraperiosteum on bone, aspirate and inject on bone. Okay?
So what Karen has just drawn is, as she's probably referred to as the hinders lines. So you can see we've created
What's
a
it called?
grid.
What kind of
Hinders lines.
Hinders.
It's designed by an architect. It's a building reference to symmetry.
Okay? So, and this is what we would call Swiss point. And the reason that we're going to talk about it is because I'm going to show you an injection point. When we inject here, it's going to give us the last bit of pull. Okay?
Okay.
Okay? So now, so we
Swiss
know
point,
now, Swiss
okay.
point. So we know we're injecting in this area here because it's going to give us the pullback that we want. Okay? Where do we start? Okay? Very simple. What you do again is I'll take this because it's clean, and I'll feel right on the bone for the suture line, okay, which is just right about here. That's going to be my starting injection point.
Now, how did you find that?
I felt it. You can feel it.
You can
Feel
feel the
the
suture
bone?
line. You
Yeah,
can feel the
it
suture
with
line.
your fingers. I can,
Like right there. It's usually
Yeah.
yeah, right there.
a little bit
So-
lateral to the end of the.
Right.
What
And
do
if
they
you
call a
can't,
suture line? There's
it's a suture line right on the, it's a break in there. So, but if you can't feel it, always just go really between pretty much the orbital rim and the hairline. Go halfway, it's a good place. Okay?
Okay.
So now for the first one, injection, you want to think of it more as a facelift tacking suture. So for the first one, you're going to pull back, inject, relax. Then it's deep. You want the most tissue between the product and the skin. So for here, you put your finger on the on the zygomatic arch, right below where you're injecting. Push up slightly and inject pretty much about a centimeter apart, working our way down the zygomatic
A
arch.
centimeter apart, meaning going
Work
up,
a centimeter
down?
going medially. So we're going to inject here, and
My
then we'll go
needle
here.
is going straight in.
Go straight down,
periosteum.
right down to supraperiosteum. Aspirate and inject right on bone. Do not retrograde. Stay on bone. And
Okay.
here you're going to inject about 0.1.
And where's the next centimeter go?
Right next to it, probably about here. And then you're going to work your way down. We're going to work our way down.
Okay.
About 1 centimeter.
You're almost creating a ladder to pull back that area. I mean, we've had trainings before where they push out as little as 0.2 cc's and you see a little lift.
Yeah.
Because it's designed structurally and molecularly to do that. Whereas when we were putting Juvederm there in the past, it wasn't designed to lift out and tent and pull. Voluma is.
You always inject in 0.1 in each of
You go about 0.1, 0.2, yeah, depending, right, Karen? You don't want anything more than that?
The more medial, if someone's really meaty, you can inject more. The first injection, I say pretty much 0.2. Now, what we say when we talk about injecting to 100% correction is when we inject, and let's say we injected 0.1, you want to see a slight raise in the skin. Once you see a slight raise, stop injecting, come out, and we'll massage it slightly back.
So when do you know you're complete? What happens? Like how do you?
You see the
What you
effects
get?
right
You'll
there?
It's a medial, it's a medial.
Okay, let me come to the other side because I'm going to give you guys an opportunity to see this.
Here's meditation.
You're not gonna remember it all, right?
There it goes.
So the needle is 27 gauge, half inch, okay? I always know you want to just prime the needle. You don't want to touch it with cotton or anything, so you don't want
Yeah.
anything to. So I like to use, if they laugh at me. If you get a little bleb or bleed back, I like to hit it with a cotton swab because it doesn't disperse the blood as much and it gives you less of a bruise. So for the
Okay.
first one, it's the thinnest part of the Zymax, so I put my finger above it and below it, pull back, and inject right onto bone. Go in, aspirate, and take a little aspiration, don't pull everything back. Go in, aspirate, and inject about 0.1.
You gotta hold that, right?
So, no, the first one, you want to pull back, it's like the front
okay.
gate. It's sort of like the cracking in the face.
Pull back the curtain.
Okay.
And it's 90 degrees. Are you comfortable? Should we raise the bed?
I'm
You wanna
fine.
Go straight in.
Deep, okay.
So go straight into bone. Feel bone,
yeah.
aspirate. You can relax, you can relax on that.
Ladies, of
hand.
all the things that are done, I
Yeah,
find
felt
that
the
the
bone.
mid-face is the most comfortable
Not much to
to deal with. Because you're
aspirate.
going
But you don't
past
wanna-
all
you
those
don't wanna-
vascular
yeah,
rich
because
areas of the
there's
dermis,
nothing there.
all the way down
Yeah.
to the bone.
Okay, and
So you're
inject about
bypassing
0.1.
all that, the action
Stay
of
on bone,
sensory
inject right on bone,
receptors
stay on
there.
bone.
So it doesn't
You wanna stay on bone.
As much as here.
0.1.
You know, there's initial pierce that goes
Go
through
down
your
to
skin, you
0.9.
obviously feel that, but afterwards. And there's lidocaine in this product,
Perfect.
powder form,
Oh,
so
so
once
it looks
the
good,
injection's
right?
been
Come
given,
on.
kind of
This looks
migrates
good.
around.
Yeah.
So now even with 0.1, if you look at her, you can already begin to see. And
Let me see.
Do you really?
Yeah, it looks
You
like
want her sitting
good.
up a little bit more.
We're gonna give
Hope
her.
your Botox too with all the lines and stuff.
So now, what I want to do is I want you to push up a little bit like this. About a centimeter.
A mirror.
Centimeter.
I want to give her a
Go down to
split
bone.
this. I don't want to take this off the lid.
That's bone. Aspirate.
Next room on the
Says
drawer.
trooper, Linda.
Next room on the drawer.
And inject slowly.
Seriously.
Stay on the bone, right?
Always on bone.
One on,
Stay
one
on bone.
centimeter.
But you may see, let's look at this thing and see if we see a raise. So go down to 0.8. A little bit more.
Yeah, I got it.
Did you see a raise? If you didn't inject a little bit more.
You want to go into the bone with this. No, excuse me.
How much
got
you putting in?
0.7 now.
0.1?
No. My general rule of thumb is I don't like to inject more than 0.2.
Good
So
patient.
what I'm doing is, I'm not pushing down, I'm sort of like doing the Niagara swish, I'm above it and below it. So now let's look at above, and you're gonna start seeing the rounding.
Okay.
How much did you inject so
Point
far?
So I did 0.3.
See how it's starting to
Yeah.
round? Okay.
Uh-huh.
So
So
now
that's
I
what
want
you
you to
want.
just come ahead, come in front now. Another thing that I like to do is animation to me is really important. Okay, so I can see we're rounding here, right here we're still really flat. So exactly where we're gonna go in, a centimeter, more medium.
Okay. You need the prep pad.
just
Well, I
did this.
wipe so much. I have the habit of wiping, so we don't need to. We clean the areas, right? So, okay.
No, don't pull down, you always wanna push up.
Push up.
But you wanna stay, where was your first one? You did 1, 2, so you
Two,
wanna
and then-
go, you wanna go a centimeter. You want short increments, straight down to bone.
Okay.
Are you literally touching the bone with the
You're literally on the
she's-
bone.
She's a good patient.
Okay,
She-
now don't move your needle. If you have to use a
Aspirate.
two-handed aspiration, that's fine. Okay, you don't have to pull, that's way too much aspiration.
Okay.
Just
Linda, do you
slight,
feel pain?
because she's gonna be uncomfortable with that.
There's a
Okay.
little uncomfortableness when you feel the needle on your
And
bone.
inject.
But otherwise,
Right down
it's,
to
I'm telling
0.6.
you, this is the easiest one because you're going beyond all that.
You okay, Linda?
Receptors.
Relax
If you
your
have a
hands, so you can
financially
relax this
concerned
hand, we'll
patient,
stay on bone and
Well, a
release.
lot of times what officers will do is they'll give them a half on each
Inject.
side and say, just
I
go
I
home
went to
and look at it.
0.6.
Now,
A
I'm
little bit
suggesting
more.
you need more. So save your money, come back and get the
Okay,
full
now
whack.
stop.
You want to give them a whack.
I didn't want to talk with the needle in my face.
Worst,
Too
No, it's
painful,
just,
or
no,
is
it
that
feels
okay?
fine. No, I just,
Yeah,
there
if I
was-
feel
So now when
fine.
I'm
Yeah.
looking, I
Back,
just see
we'll do the
above,
rest.
she's
Journey,
flat here.
journey,
So I wanna
journey.
go a centimeter
one time.
forward, push up,
You're too young.
and inject.
Pull down.
No,
I just
always
got
up. No,
confused.
up.
Push up.
Up.
Push up. Okay, so this is
I
my
wanna
point.
switch needles, because now remember, we're going down to bone, so we have to switch needles.
Okay.
And so they're
Okay.
switching needles
Switching
every
needles
couple
to avoid any-
I say every
Injections.
third injection, I
Every
switch
third
needles.
Switch
injection.
needle.
So I
And they're gonna
save,
change
I
it.
save all of mine
Actually,
from
using the
Juvie,
reference, you know.
and I save all my needles, because I for a Voluma case, I can use 10 needles.
Well, and
Oh,
you and I are on the same plane all the time. We give you 4 needles,
Okay.
and that's a reason in between the 2 boxes. You're hitting bone, and as soon
So
as you
this
touch
is
that bone, you know
about a
you're going to
sonometer?
needle.
No?
So for patient comfort, change that. Throw it away. You know, if you're going to do both sides, you got 4 syringes to use. Make it more patient.
But you can
Friendly.
do exactly what you're doing, but you see, you have to do it to 90 degrees.
90.
That's correct.
Straight down to bone,
You're
aspirate.
doing how much injection?
1 on each side. You know, and I've seen
Okay.
patients
Oh,
get
you mean one
3
full
But if you
syringe?
move from
total.
the
I've
bone,
seen
you
get
have to
4. I've
aspirate.
seen people have
Inject.
Voluma off-label down the
Okay.
jawline. You get
So
7, 8
I can't
syringes,
move this,
temporal hollow.
this
you
finger or
aspirate?
Be a home run there.
Was this
I
originally
move
put in
okay.
for patients with HIV?
two fingers?
Who have fat, atrophy of the
Like a
fat?
like a
Relax
hectic
this, 'cause I
looking,
wanna
really
be able
drawn
to
in.
see-
Yeah.
Stay on the bone, inject.
I think it'd be too expensive, to be honest with you. I know some providers use some other things for their HIV patients.
Okay. I do a lot of HIV patients.
With Voluma?
Come out, yeah, come out now.
What about you do autologous fat transplants there?
No, a lot of people have had, a lot of the HIVs have had, believe it or not, a lot of Sculptra,
Yeah.
and they weren't happy because what happens is it takes too long. And when you're talking about like the temple hollowing or the submalar hollowing, Voluma does an absolutely beautiful job. I gotta be honest.
I was talking to that over here for,
Yeah,
I think,
unbelievable.
there it
Let's
is.
sit
Is
her up now.
Zalgan the one that does Sculptura?
Sculpture?
Now we're gonna
Yeah.
look at her.
No, that's a different
Okay,
company.
smile for us.
Sculpture has
Okay,
about
so you see?
4 or 5% of the market
Come
share.
this way, walk in the front. Okay.
Compare the left, right, and the right side.
So remember we were talking about Swiss Point?
Yeah.
See how
Diana,
flat she is here? So what I want you to do is I want you almost to push that little fat pad up like
left side and
this.
right side.
So, and the reason I do that is I know my finger here is still on bone. So I know even if a man's medial, I'm always injecting on bone. I'm never in this no-fly zone. So I'm gonna go push the fat pad up because I want to grab it. And I'm gonna go straight down to bone and inject. I want you to go down to bone, aspirate, inject 0.1. Then I want you to stay on the same exact line, come up and like snowman it, and inject 0.1 on top of it. And that's gonna give her a beautiful lift.
What does that mean, snowman?
Snowman one on top of the other, stacking.
Oh,
You see the difference? Do it. I wonder.
Leave that for us. Push your tush back.
Oh, I'm just, I can't pull my tush back. This is doing it.
Push it back.
Okay.
Okay? So you see what I'm saying?
Yeah.
So I'm gonna push back. So my
what happens to I want the natural woman? Is anybody natural anymore?
This,
so now.
I want this to look natural.
I'm natural. Keep it so quiet, natural.
Straight on bone, 90 degrees. You always want to go just slightly down. You want to go straight on. Straight down to bone.
on the lips.
Go down to bone. You're on bone?
Yeah.
Aspirate. So I want to make sure I aspirate right on bone, so I'm going to hold my syringe. Perfect, relax. Okay. Inject straight on bone. Don't move the needle. If you move, you have to re-aspirate.
Okay.
Okay.
That's it.
Okay, so inject 0.1.
Well, aspirating
God, it
is
looks so
moving
good if I
the
do this.
needle, I think. I'm moving the needle when I aspirate, so.
You don't want to. Okay, now come out, now come out to sub-Q, because you can inject this in sub-Q, which is about a quarter of the needle, and re-inject, relax this, and re-inject right on top of it.
Aspirate?
No, just
Keep
inject.
them alive, yes, okay. Just-
Little more, little more, little more, little more, little more, little more, little more.
I wonder who does chop swap in the city.
Stop, and come out. Look at that. See the lift? Now I want you to step behind her. We have a little more product left. Look, keep